Welcome. My name is Dr. Edwin Muinga Chokwe, a mental health specialist and interested in community interventions, education and empowerment in terms of mental health. We've been looking at the mental health, perspectives of mental health. We've looked at the environmental factors that are involved in mental health. And I've also an interest in environment, climate change, planting of trees, mangrove conservation, and generally all matters that pertain to clean and sustainable environment. It's very clear that a clean and sustainable environment is fundamental, is very important for good mental health. We noted that previous changes in the environment, like what happened in Hiroshima, the nuclear bomb which was dropped there, the various reported accidents, nuclear accidents in power generating plants in Ukraine and other areas, in Japan, Fukushima, that there's an effect that transcends centuries as the radiation is emitted in the vicinity. So as we continue to develop and as we go into renewable energy options, nuclear energy is one of the energies that is used with very serious repercussions in terms of any leakages, should there be any. And in these days of wars and rumors of wars, they form a target for bombardment by the enemy, who will not care less about the after effects, whose effects may actually even affect the ones who are bombarding them, the generation that is there, and the future generation. So mental health cannot be proper health unless the environment is also conducive. We like nations and individuals, countries and nations and governments to concentrate and focus on providing a clean and sustainable environment. In fact, some Scandinavian countries have gone a step further. They have cleaned up all their mess until now. Some of them don't even have garbage anymore because their garbage is well taken care of. They are making recycling. They are making energy out of the garbage. They are making money. And they can no longer get enough garbage. They have to import garbage. Now this is the area where African countries should aim, because most of our towns, villages are littered with garbage, uncollected garbage, or garbage that is not well processed so as to be useful for humanity. Garbage, as we know it, is a very expensive commodity if well utilized. You can generate energy, you can generate fertilizers, you can generate job opportunities in the recycling area. But when it is left unattended, then garbage becomes a source of ill health, ill disease, as various strains of mosquitoes start developing there, the dengue fever, malaria, and other infectious diseases like cholera, typhoid fever, dysentery. All these are associated with uncollected garbage near homes. So if we do not take care of our garbage, if we do not take care of disposal of garbage, processing of garbage, it means the morbidity or the sickness levels will be high in the areas that we come from, the village, and that is, it will impact on our work output. Not only that, it will burden the healthcare services, because the healthcare services will now be dealing with these products of bad environment. Most of our patients in these hospitals and clinics will be those people who should not have gone to hospital in the first place. If they had good sanitation, they had clean water, clean air, they would not need to go to big hospitals. And therefore, the governments will not be needing to have huge hospitals, because we build huge hospitals because of the ill preparation. We don't prepare well, we don't prevent. We know initially we talked about prevention. Prevention, we know, is better than cure. And African governments have to invest in a prevention. Once we provide people with clean water, with clean environment, clean air, that is good health. And they are unlikely to be suffering from all these conditions that are associated with bad environment, including chest complications, coughs, and where there is nuclear complications, things like cancers of the blood, leukemias, all these associated with bad environment. Luckily, in Africa, we have an abundance of raw materials, we have an abundance of water. We can produce hydroelectricity safely, we can produce solar power, we can produce geothermal electricity. Now, these are renewable sources of energy which are clean, and they are likely to cause any harm. But unless we invest in that, then we may be forced to go the other way. The first world, they went into nuclear, and most of them now are decommissioning their nuclear plants for a better and a safer way of living. So in a nutshell, what are we saying? A good environment and mental health go hand in hand. Good environments and good physical health, general health, the well-being of the children that we have, the adults, the elderly. All this is important, that we have good environment. Once we have good environment, we have less morbidity, less infections, less diseases. If you have good environment, you're going to have less stress within the community. There's a lot of stress emanating from poor environment, smoke, and general pollution of the environment. People end up being stressed up and getting other neurological, neuropsychological disorders like stress, depression, insomnia, and the like. So, in closing, let us take care of our environment. Remember that mother who is pregnant today, unless she is living in a clean environment, that child may be affected. Remember that child who is growing up today, unless that child lives in a clean and sustainable environment, she is unlikely, or he is unlikely, to reach his potential or her potential. The workplace will be affected because most of the time there will be absenteeism. People are not going to work, whether they're either physically sick or they have stress, and the work output and production will be low. It's important to appreciate that these factors, they are important in our health. Thank you very much. If you have any comments, Let's talk, let's discuss. We shall continue on other aspects of mental health. Today we have looked at the environmental aspects, the effects, and that we need to do something to have a sustainable environment that was originally, especially in Africa, where we had forests, we have rivers, and all these have been cut. They are drying. The rivers are drying. The forests have been cut. There is excess loss of water. There is climate change. There is global warming. All these factors can be reversed if we focus on maintaining and managing our environment.